Good morning. My name is Cheryl Lake. I am an artist and tattooer for over 20 years here in Tucson, Arizona. Today I wanted to go over ways for you as a tattoo artist to be able to offer um, areola tattoos to your clients if they come up and ask you. There are just a few things that you need to learn that are a little bit different than your normal tattoo process. I became a paramedical areola tattooer in 2020 because I saw some people who had had theirs done and just felt like I could do a better job. So I always wanted to be able to help people out, and I decided to take a class to see if there was anything that I actually needed to know that I didn't already know as a tattoo artist. That's whenever I found out, yeah, there are a few things. There are a couple different techniques, and there are just some medical things to be aware of and ways to make sure your client is comfortable. If this is something that you wanted to be able to offer to your client if they come up to you and they need an areola tattoo, then this is the class for you. First things first, tattooing your client with an areola tattoo is a privilege. So let's go over a few ways that you can make sure that your client is comfortable. Now, for one, our music listening. When they come in, they may not like your type of music that you listen to. They may tolerate it for other tattoo appointments, but this one is a little bit different. So give them the option to choose a music or, bring their earbuds. Just make sure that you know that your client's comfortable. You can make sure that they have extra pillows, a nice place to sit. I like to use a little stuffed animal, so I have an emotional stuffed owl. And I use a lot in a lot of my tattooing, actually. And it helps a lot if somebody has something to hold on to. If they're at a place like that where they need something to snuggle, they can put it underneath their arm, or they can just hold it before the appointment. When setting your client up on your table, you want to make sure, of course, to use your drape sheets and cover. And you want to make sure you have a pillow that will support their head properly the way that they want it. So I have like a couple different choices behind me. I have big fluffy pillows. I have this pillow, it's more flat. A lot of clients like that more. But also placing a pillow, if they're laying flat on their back, under their knees, will just help make sure that they're more comfortable. But be sure to check in with them, because sometimes things have messed with them to a point where they can't sit or lay certain ways. So just make sure that you are taking the time and addressing how comfortable they are when you do get to the point where you're lying them down. During your consultation, the important questions that you need to ask are, do they want a specific shape? Because sometimes you'll find that if they are starting with a blank space, that they might want a little heart, which is really cool, and you can offer that. Another thing to ask is how long since they've had their last surgery, and if their doctor has cleared them. So what we're looking for is at least 6 months, and we're looking for doctor clearance, because there are a lot of things that we don't know that's going on that the doctor will know that maybe they need to do in the future, where if we tattoo them before they get clearance, it may interfere with the process. And we don't want to do that. We want them to be able to heal as quickly as possible and to feel like they're normal again, or as normal as they can be, you know what I mean? So let's just make sure that they're healed properly and they have clearance before we even schedule that appointment. Okay, there are a couple of ways where tattooing a client after they have had a mastectomy can change the process in which we have to approach the tattoo. One way is trauma. When you have gone through such an extensive amount of time where you're being poked and prodded, you have had so many surgeries and all these different things going on, and also radiation, they can have a trauma response when you are getting ready to tattoo them or during the process. Now, a trauma response doesn't always mean like anything that you even see. They may become more quiet and still, and they may also cry. And knowing these things would just help you gently guide them through this process. This is not as simple as tattooing a realistic areola. This isn't just a technical challenge. This is a technical and emotional challenge. It is something that they have been working and gearing themselves to. Regardless of whether they tell you they're okay or not, doesn't matter. You need to approach them with just confidence and just understanding that this can initiate a trauma response, and that there are ways to just be more gentle about it. And some of those things, just making sure that they're comfortable when they're laying in the chair, give them plenty of pillows, give them a little stuffed animal like Cootie. You can always get them something that they can take home with them, whatever you want to do. A stress ball or something for their hand, and get them their special drink, things to make them feel good. And that will help for a lot of the different things that are going to happen with them emotionally. It'll help them walk through it. And then physically, you do also have to know that the skin is thinner in some areas, thicker in other areas. You have to approach it with a very gentle touch. This isn't a traditional tattoo outline type pressure. This is a gentle shading stroke pressure. You can do some of the times I do like myself, I do like the pendulum swing, and then when making texture, I kind of do sometimes like little figure eights, and that helps kind of create that, because areolas aren't just like this flat colored piece. And I do see people do that a lot, and it's not that they look terrible, but they could look better. And each time for myself, I even challenge myself. Each time I get better and better, because that's my goal. I don't ever feel that I'm like at this point where I have learned it all, but you take each step and you learn as you go. Another thing as well is the radiation. A lot of times when they've had radiation during the process, it does make it so that the healing process can be a little splotchier for them, meaning the ink doesn't always like to take really well. The skin, again, is just really different. It's got a different texture, a different feel, and as an experienced tattoo artist, you will know that as you start to get into it. But it's good to be aware that it's also a combination of things, and just to be cautious as you were starting in your shade and adding like to your stencil and stuff like that, that whenever you're putting your pressure on, it's always best less is more in the beginning, and then kind of see where your process builds up. Like you'll notice, okay, so this is good, or I'm not putting enough pressure, because sometimes even though the skin is visually thinner, it also responds a little tougher. So it's a constant thing. And skin anyways, as an experienced artist, you already know that it can kind of switch and vary depending on people's health and lifestyle and different processes. Well, this is kind of the same thing. Okay, so you also want to use a good pre-topical numbing cream if you can. The one that I suggested is the Zinsa. So this one is great, and it's designed more for cosmetic tattooers. So you use it for like microblading and stuff like that, and it's supposedly designed so that it does not mess or interfere with the pigment in the healing process, because sometimes they will. But this is also an important thing to know, is that this is not only a topical, but you can also use it during the tattoo process. So you can tattoo through it. You don't have to like wipe it all off first. So making sure that you give them a good time for numbing, and you use the product as needed throughout the different stages of your tattooing to make sure you get the most comfortable results possible. Now, also something to keep in mind is that not every woman actually needs it, because sometimes there is no feeling or sensation there. So take it as you can, you know, always approach it with the possibility of there being pain and you wanting to relieve some of the discomfort. So start off by applying that numbing agent on for whatever it recommends. Like I do at least 15 minutes, and you can have that numbing while you're setting up your station or doing whatever. But this will just help give you an extra ability to make their comfort level even higher, which, you know, you can't go wrong with. So when you're going to mix colors, I have found that this works pretty good for some of it. This is I got this off of Amazon actually, but it shows you right here where you can get it from there. And this, it has all the colors broken down from the Fitzpatrick scale. If you do not have another nipple or areola, you can basically start off with something off the Fitzpatrick scale. If they already have one, then you need to mix colors, which I find I do a lot of color mixing anyways, which makes having note cards important, because I do things like this. This is for eyebrows, but I have like little mix things where I've taken notes. But anytime I am working with a client, I am creating little palettes. You know, this one, we've got a couple of the color mixes that I already have, and so on. But anyways, so I just make sure I put the name, like what it is that they're doing, what colors I used for the process, and I will make a little notation as well to what it is that I had to mix it, you know, for like here I've got, and then we added white, and so this is kind of like little splotches, so then I can just match off of here. Okay, so your setup is basically the same as when you're doing tattoos. This is some fake skin. Different, you can get different tones, different color tones. I have this one over here, which I was doing earlier. I have this one. This one has both. One that shows like some different fake skin, and then one that has a nipple on it. I like to use ink beetle for my bandage, and then I also like to use 5 round liner. This is a 25. But a larger round shader doesn't have to be that big. And then 11 mag or 9 mag. Since numbing is perfect. Some paper towels. And all right, so now that we have all of that and we have our setup, we are going to begin by making a stencil on our fake skin if we want to practice. And so I've got this one. This isn't like the best color because I don't know if any human is actually this color, but this is the one that I have right now. So I'm going to just kind of go through. One of the things I like to use for stencils, I will use a circle template. So that seems to work out well. Usually about, areolas typically aren't bigger than 2 inches, but always be aware that your client may have other preferences, and it is up to them. Like if they want something small or something larger, usually there are certain sizes that we try to keep in mind. But aesthetically, it's got to be their choice. And you, as an artist, also knowing how the human body looks, and just like all the studying of anatomy and stuff that we do even unintentionally, just keep that in mind and always give your best advice when helping them pick out a size. Okay, size wise, for something like this, I would go for, let's go for 1 3/4 inches. Or we could do 1.5 inches. Just depends. So my client, she doesn't want anything big, so she's gonna do 1.5 inches. We're gonna just kind of create your shape. This isn't gonna be perfect because we're not looking to make this actually a circle. And then your nipple. You can eyeball this, but a lot of times we're trying to match it. I'm not gonna match it today, but, and then you're gonna kind of create maybe a couple spots where you have your mammary glands, your ducts, and then we got some wrinkles. And that would be basically your stencil. All right, to start, I'm going to use my 5-round liner. I'm going to run it at about 6 or 7, and I'm going to slowly go in and I'm going to lightly define the areas where my stencil is, and then kind of gently shade out to the areola area. I don't want any lines or anything harsh, so I'm going to go in there gently using just a light pendulum swing as I am trying to gently guide the ink into the skin, and also test the waters to see how the skin reacts. If it seems like I need to use more pressure, I can apply that as I go. Okay, so remember it's not a race, so take your time. But I just want, after you're done, you just want to have like this gentle sort of, that's basically your stencil just defined. From here, we're going to create some textures around the pattern, and we're going to just start defining. We can do your shadows and definition. I'm going to use this, which is my 11 mag, and I'm going to create some textures and kind of just color in the area more. All right, so running it at the same speed. I'm gonna start doing little figure 8. Instead of a traditional shading, I don't know what that was. I'm just kind of lightly overlaying little figure 8 shapes. Okay, so you have a little bit more definition. Now I'm going to go through and I'm just going to start adding detail. For this, I'm going to switch back to my 5 liner, running it at the same speed. And I'm just going to go in with a shading tone. I'm going to start define this, and I'm going to start to create my nipple and my textures in my nipple. Being mindful of where like my lighting would be. Knowing that I need to have a shadow in this area to help define this and make it look like it's protruding. When you start building up the shading, remembering that as you're doing it, shading at like angles will help with you creating the dimensional effect. All right, so as we're going, we're just starting to see more and more, and we're just going to continue defining and bringing out details. Whenever I start coming to the edge of it, I do like to start doing little stippling, just to kind of like soften. We're not doing precise stippling, we're just kind of creating that. This like textured blend, and we're like blending this out a little bit. We don't want it to be super pronounced. Obviously on pig skin, especially this one, it's so pale, it's always going to be a little bit more noticeable. Now we're going to add subtle details. We're going to create our little vein. It's just very subtle. because there's usually a little vein underneath there. And then we'll do highlights. So when adding highlights, you're just going to, to be thinking about how the light is going to hit the three-dimensional areas. And we just want to like brush it in. We're not looking for giant, super, super shiny highlights, just some definition. And here I'm just adding some additional shadows, lightly blending. Making sure all my blends are good. I'm not really a big fan of tattooing on the silicone. You don't get the same effect, but it still works great for practice. After your appointment, going over aftercare is typically very similar to that of your normal tattoos. You're going to make sure that they lightly moisturize it. Even just an unscented soap is good, or unscented lotion. And then, your mild soap to wash it a couple times a day, avoiding too much sweating and hot tubs and the typical standard procedure, with the exception of the fact that this is kind of in an area that can get more sweaty. So I always suggest to, in between, if they are wearing a bra, that they can like tuck in like a paper towel or something just to keep any ink transfer or anything like that. I also like to use the Ink Beetle brand of bandage, basically, because it is just a gel and then it peels off. There's no like worries about being allergic to the adhesives, and it stays on 2 to 12 hours. They do have it so that you can buy little packs that you can take home, but it's usually not necessary. When you're doing this, everything is done in like these gentle layers, and so the skin should not be to the point where it's going to bleed through a whole lot. Everybody's a little bit different, but I feel like it is good to know that there should not be a lot of blood or plasma present during this process. Another thing to be aware of is that I always schedule a perfecting session, is what I call it, but basically a touch up. And you're going to do that right within about 4 to 6 weeks, depending on their skin. I typically stick around 4 weeks. I usually find that that's fine. 6 weeks is even better, but always have them come in, and then that way you can make any minor adjustments to color, darken any areas that you need for your shadows. Maybe if you need a highlight added back in, all that type of stuff can be taken care of in that session. And it just makes sure that they're good to go for, the rest of the process. And then making sure that they keep the tattoo, obviously, if they're going to be doing topless sunbathing, they have to use plenty of sunscreen. With the lighter color tones, how they will fade away. So making sure that they know that, like, the more sun they get, obviously they will need a touch up with time. So taking care of it, it's not usually an issue, but something to be aware of. Well, that is it for today. Thank you for coming and watching, and hopefully this gave you enough information to help guide you. I am willing also to sit down and talk with you, and if you have any questions, feel free to ask me. I'll have all my information with wherever this video is going. I thank you, and I know that whoever it is that you tattoo will appreciate you taking the time just to see what ins and outs that you may not know. And as always, take care of yourself and take care of each other. Bye.